Hi, my name is Kirstin Morrison, and I'm from Caledon, Ontario. Health Canada, you have told us that you'll consider some public input before making a final decision regarding Safety Code 6, and I hope today that you'll consider some of mine. Like many Canadians, my greatest concern is for the health and safety of our children and for future generations. Although the World Health Organization has reclassified radio frequency electromagnetic fields as possibly carcinogenic, our society is being exposed more than ever before. In addition to home routers, cordless phones, baby monitors, and smart meters, Wi-Fi routers are being installed at Canadian schools, and school boards are promoting BYOD, Bring Your Own Device campaigns for children. Children as young as 4 years of age are being encouraged to bring wireless devices to school, including smartphones, tablets, and laptops. Now, for the very first time in our history, children are exposed to electromagnetic radiation at school for many hours a day, 5 days per week, over 200 days per year. Why is this unprecedented level of exposure to electromagnetic radiation happening? Because Health Canada's Safety Code 6 says it's okay. There are numerous studies that show that exposure to electromagnetic radiation from wireless devices is linked to cancer, fertility problems, conduct problems in children and adolescents, and symptoms of electrosensitivity, which include headaches, dizziness, nausea, and heart palpitations. There are studies as well that show that there are adverse effects from fetal exposure. Although the Royal Society of Canada, their panel, did not support precautionary measures at this time, you need to know that thousands of reputable scientists, medical groups, and governments around the world feel very differently about the need for precautions. I'd like to run through a few of them right now. The Parliamentary Assembly Council of Europe released Resolution 1815, which includes restrictions on Wi-Fi in schools and the use of mobile phones by children. The American Academy of Pediatrics, representing 60,000 pediatricians, is calling for updated safety levels, pointing out that children absorb more radiation due to their thin skulls and developing brains. Medical doctors in Germany, in their Friedricher appeal, suggest a ban on mobile and cordless phones in schools. The Austrian Medical Chamber, representing 40,000 doctors, warned about adverse effects and recommended Wi-Fi free school environments. The International Society of Doctors for the Environment recommend avoiding Wi-Fi and using wired connections whenever possible. 29 experts from 10 different countries authored the Bioinitiative Report, which outlines a number of adverse health effects and recommends significantly more protective safety limits. Public Health Minister Laurette Onkelinx in Belgium recently announced that sales of mobile phones to children will be banned in shops and on the internet. Advertisements will also be banned during children's programming. The American Academy of Environmental Medicine has taken the time to write school boards in the US and in Canada, urging them not to install Wi-Fi and not to promote the use of wireless devices among children. Switzerland, France, Germany, and Israel are all taking action to stop the installation of Wi-Fi in schools. Sweden has recognized electrosensitivity as a functional impairment. In Toronto, a clinic at Women's College Hospital is treating electrosensitive patients, and I've heard right now it has a 12-month waiting list. Insurance companies believe that there's cause for concern. They are not insuring manufacturers or service providers for health claims due to radio frequency exposure from devices. Telecommunication companies themselves are responding to the research. Although it does take a magnifying glass to read them, they are issuing warnings to keep wireless devices away from your body. The media and popular television shows viewed across North America are picking up on how real these concerns are. Talk shows like Dr. Oz have been featuring recently doctors who state publicly that they believe that the cancers they're seeing more frequently in young people are linked to cell phone use. Health Canada, we want to thank you for considering our input. Please, let's not lag behind countries like China and Russia when it comes to a safety code that is meant to protect our citizens. Please make the public aware of the risks associated with electromagnetic radiation exposure, especially for children. As a parent, I can tell you that there are few things that cause parents more concern than the inability to ensure the health and safety of your children at all times. And without your support, parents like us will have no choice but to continue to send our children to school every day where they are being exposed to a possible carcinogen. We ask that you please issue strong recommendations to school boards that they take precautionary measures by favoring wired as opposed to wireless internet in schools until it is proven that there are no negative health risks at all. We really look forward to hearing your announcement in the fall, and we are counting on you to make the right decision for all Canadians, and especially for our children. Thank you for listening.